Views expressed are solely those of the speaker and not necessarily those of Paltalk.com, AVM Software, or its advertisers.
News Talk is online. News Talk Online is a production of Paltalk.com, the largest multimedia interactive program on the internet with more than 4 million unique users on demand on iTunes and on YouTube and on my site, GaryBaumgarten.com, where you're encouraged to post your comments, whether you agree with yours truly or not, and where you can subscribe to my news feed, Twitter.com/GaryBaumgarten, to keep yourself up to date on all the most important things happening in the news as it happens and make yourself a very informed chatter here on Paltalk. By the way, there are links to everything that I post on my Twitter feed. So it links to the stories so you can decide for yourself about those issues. It's not just a 140-character diatribe coming from me about things that I believe in. I actually link right to the stories. And thanks to our good friends at CRN Digital Talk Radio, we're syndicated to an additional 12 million households. I am your host, Gary Baumgarten. I welcome you to the show. Well, for those of you that have been with us throughout the day, you know, because we brought it to you live right here on News Talk Online on Paltalk.com, the president once again has been taking his health care reform proposal directly to the American people. He knows he has to if he has any chance of it passing in Congress, even though it seems to be starting to slightly move along in Congress. But not only are there Republicans who are opposed to it, but there are Democrats, conservative Democrats, who are opposed to it as well because they're concerned that it is not fiscally responsible. So he is running this campaign like he ran his campaign for president, by taking it directly to the people in the hopes that during the August recess, when Congress members typically go back to their districts and actually face their constituents as opposed to the leadership of their own parties and the lobbyists, their constituents will carry forward the message, we need health reform, to the president. Now, of course, there are those on the other side of that issue who are going to go to the members of Congress and say, hey, this is going to cost us way too much, we can't afford it. Well, we've been discussing this issue on and off, probably in greater detail than anywhere else where you can find information about this. But a lot of you have been saying to me, Gary, you've had people who are in favor of it, you've had people who are opposed to it. We want to hear from a doctor. Well, today we are. Dr. Andrew Coates, C-O-A-T-E-S, is a practicing physician in Albany, New York, and he represents Physicians for a National Health Program. He's been so very kind to join us here today on News Talk Online on Paltalk.com. Dr. Coates, welcome to the show.
Thank you very much, Gary.
Well, thank you, sir. Now, let's start with a basic premise. I believe that even most individuals who are concerned about the cost of the president's plan, even individuals who say that they are fearful that the president's plan will socialize medicine in the United States and they are opposed to that on philosophical grounds. Even those individuals, reasonable ones, would recognize that we do have a problem when it comes to how we fund health care in the United States. I am privileged to work for a wonderful company that has great health care benefits. So if I was up in Albany and I wanted to knock on your office door and say, Dr. Coates, I'm in town, I need some help with a problem that I have, you could see me and I would just hand you the card, pay my small deductible, and everybody is happy. But there are a goodly number of people in this country who are uninsured or underinsured. Would they be able to do as I do, walk right into your office and get the same kind of care that I get? And if they did, would you have to eat the cost of that?
Well, I think I think Gary, maybe I should lay out a little bit about Physicians for a National Health Program and where we're coming from on how to begin to answer this question, because
Okay.
as a young physician just out of medical school and in training, and then just out of training and in practice, I was taking care of very sick people in the hospital. There were some shocking inequities when it came to how healthcare is paid for, and what happens to different patients with different payer sources, even those with insurance. And I took a very serious look to see who had the evidence, who had the data. And the Physicians for a National Health Program for now over 20 years has accumulated an evidence-based case for health reform and come up with a proposal, founded around a proposal that we cover absolutely every individual from birth to death, and also rein in costs. And in fact, over the decade that Washington, D.C. is talking about, it would save trillions of dollars over the coming decade. So if I could think about the way that you're asking me about a patient, obviously, that has no health insurance, has a great problem with access to care. Cash out of pocket for a visit all by itself is exorbitant. To try to get any testing becomes prohibitive. If a patient has poor insurance, they may have a very high copay or an astronomical deductible. For example, in Massachusetts, where working people have been forced to buy health insurance under the reform there, individual policy that's cheap for a worker making $35,000 might be, say, $4,000 or $5,000, but there would be an additional $2,000 deductible. So you're $6,000 out of pocket before you get any health care at all, paid for by the insurance company. So there's a kind of enforced underinsurance in that. But then there's the problem of those with the good health insurance, because we all think that we are so happy to be covered up until the health calamity strikes and the bills start coming for the things that aren't covered. When the number of bankruptcies, as you know, has been rising in the United States, but the percent of the bankruptcies due to medical bills is really almost about 2 out of 3 bankruptcies are due to medical bills. But the shocking statistic is that 4 out of 5 of those bankrupted by an illness have health insurance. So the health and private health insurance is really not working for any of us. How this debate in Washington got twisted into a debate on how to get everyone private health insurance, I keep scratching my head, because we don't need health insurance. We need health care. We need to talk about how every person will get the best possible health care. And that should be where the debate starts and finishes, in my opinion. Sorry for the long speech.
No, that's fine. I just want to point out that an RNC poll, their own internal polling, recently suggested that 60% of Republicans want some kind of health care reform. So I don't really think that this is a partisan fight necessarily, although some people are making it that. We have seen that. And I think that as a result of that, we may be losing focus on the point that you just made, and that is it's not about health insurance